Lori's here.
Okay.
Hello.
Hi.
Sorry, I was trying to get here safely.
Oh, that's fine. And your name is?
Lori.
Lori.
Aragon, right?
And Aragon. There's two of us. That's why I was using my middle name.
Okay. You're the one I talked to the day of, though, right?
Yes.
Okay. Well, Detective Gonzalez again. It's Corporal Minter. Well, Detective Corporal Minter.
Hi.
So, could you just start from the beginning? And if we have any questions, sorry if I interrupt you. I just have a habit of doing that sometimes.
Okay, what happened that night?
So so January 27th, the incident happened like 3 in the morning from when you first had contact with the patient to when you last had contact with the patient.
I actually had contact was with the baby.
Okay.
She had buzzed to go to the bathroom, so one of the nurses was going in there anyways because she was gonna set up for them to do like, pap smear and everything. So she was like, "I'll go ahead and disconnect her and she can go to the bathroom." So I was like, "All right." So she was in the bathroom, and then Chris, which is one of our other nurses, he was like, because I was like, "Dang, she's flushing that toilet like an awful lot."
Oh, so you noticed her
Flushing,
toilet?
yes. And then he was like, "Well, damn." So I went and I knocked on the door, and I said, "Are you okay?" And she said, "Yes, I'm fine. I'm just having a hard time going to the bathroom," is what she replied. So I was like, "Okay." And then I was like, "Well, push the call light if you need anything."
So you told her to push the call light? Or
Yeah, if she needed anything. And then, like a few more flushes had gone by, and then that's when Chris was like, "I don't know," because I told him, "What if she's having a miscarriage in there and, flushing stuff down the toilet?" So he knocked on the door, and he's like, "You gotta unlock this door." And then she wouldn't reply, and he's like, "If you don't reply," he goes, and then that's when she heard him call for me. And he was like, "Laura, you got the spare key to this bathroom?" And I was like, "Yeah." Because we keep like a ring of keys by the desk where I sit. So I went and I got the key, and just as we were getting ready to open the door, she opened it, and all I saw was like blood everywhere, like on the walls, on the toilet. It just looked like a horror film.
And you say where it is also on the floor too?
Yes.
Okay.
And then,
Now, was it covering the floor, or was it like splotches?
You could tell she was wiping it up with paper towels because it was like smeared.
Okay.
Yeah. And then, the one that does have the footage of that, she's on vacation right now, is Erica, and she works in lab.
She took photos of it?
Before, because she was like, "Whoa, this is like..."
Well, I didn't know that.
Yes,
Huh.
and I didn't know that either till just recently.
And who is that? Erica?
Erica.
Compost or...
No, let me give you her last name just a minute. I'm terrible with last names.
Oh, you're good.
But she does have the
Erica
videos.
Salas.
Yes. She has the pictures.
Is she a lab tech?
Yes. And she's
Okay.
on vacation right now.
She's the one that's going to come next week.
On the 27th?
Yeah, in 2 days.
Okay.
Sorry.
So and I did tell her not to erase that.
Good.
I said, "Do not erase that, because that's evidence."
When did she find them? Or when did she tell you about them?
I think it was like 2 weeks afterwards.
Oh, okay.
She had shown me the pictures, and then that's when I told her, "Do not," because I was like, "Dude, can you believe that?" Like, because we had a patient that was pregnant at the time, just like after that, and I was like on top of it. I just didn't want another recurrence.
Gotcha.
But yeah, so anyways, the floor was just smeared with blood, blood on the wall, like on the toilet and stuff, and
Do you remember which wall?
it was like the back wall between the toilet and the sink.
So, like, if you're looking at the toilet, like...
Yeah, like, say the toilet's right here where you're at, and then the sink's right here. It was, like, up this way, blood splatter. Like...
In your line of work, what would cause that kind of splatter?
I think something that got pulled out or ripped. Like if you ripped something and blood just went, it was like once you see the photo, you'll see what I'm talking about. It's just...
So, like you say, like, rip, like something went like that?
Yeah, like when you rip something, or if you cut something and you go, like, you swing your hand and blood just splatters.
Okay, so...
That's how it looked.
Oh, okay.
Yeah.
And that'd be on... So, this is north. That's east. It'd be on the west wall?
The back wall? Yeah.
So, because, like, the call button's on the south wall. So, it'd be on the west wall?
Yeah.
Yeah, because the bathroom is like this.
Yes.
Here's the door.
Yes, and then there was
The toilet, and then the sink,
Yeah, and it was up on this wall, the
and then
blood.
the call button.
Yeah, it was like in between here was the blood splatter, and then there was trickles of blood on the wastebasket that was right here in this area, and then there was like smeared blood all over the floor.
Oh.
Yeah, we just kept hearing the paper towel dispenser going and the toilet flushing. So yeah, when we opened up the door, like we saw that, and then I noticed she had bloody footprints that she was leaving, going back to the room that we had put her in. So I had called housekeeping, which was Leela, and I was like, "Hey Leela, I'm sorry to bother you." I said, "But I think this patient just had a miscarriage in our bathroom and she left like a mess. If you could come and clean it." And she said, "Okay." So she came down and she started cleaning it, and then she went to pick up the wastebasket, and then she put the basket down and she yelled for me, and she was like, "Lori, come here, the wastebasket's heavy." And I was like, what do you mean the wastebasket's heavy? So when I picked it up and I moved it towards the door, I was like, shit, it is heavy. So I pulled it out because it had like a fresh liner inside, so we didn't think nothing of it because we looked. So when I pulled the liner out, there was like paper towels. Then we had rolled trash bags already in there, but she had grabbed a few and like balled them up and put them on top of him. So when I removed them, that's when I noticed the baby on the bottom of the trash can, just wrapped in the bag. Like she had it tight, like because it was the top was twisted and then like tucked under, like so it wouldn't open up.
So basically, if you like
when you grab trash and you like swing
it and then you fold it over to like put it down or whatever.
Yeah, that's how it went.
And it was clear.
It was a clear bag.
So,
yeah, it's one of those clear bags.
So you
So it was a
saw.
hospital liner?
So you saw the baby inside the bag.
Yeah, and then when I picked it up, that's when I noticed it even more because all I saw was black and purple. But once we picked it up, like the bag suctioned to his face, and that's when I yelled for my charge nurse, which was HT, and I told him, "Hey, she put her baby in the trash can." So I handed the baby to him, and he took off to the trauma room and opened up the bag, and then that's when we went and got Dr. Vasquez.
Now you say that the bag was suctioned to his face. So was that from?
I think when I lifted it up, it kind of loosened, and so it just where he was still moist, it just suctioned to him.
Okay. All right.
Question for you. When was the last time y'all were in the restroom before her?
We had another patient that was in there, I want to say like around midnight maybe.
Who do you remember who it was? Or what they were in for?
They were there too. They left us a specimen on the table there in the bathroom, and I went in to pick it up.
You did it at midnight?
Yeah.
Was it clean?
Yeah.
Okay.
There was no blood or nothing.
So this was fresh to you?
Yes, this blood was fresh. You could even smell it.
Did the patient at midnight, were they by chance pregnant at all?
Honestly, she, to me, did not look pregnant, but then she had on a hoodie.
No, the patient that gave the sample at midnight.
No, she was a young girl. She was like maybe 11, so no.
Okay. And there's no blood at all?
No.
She would have noticed, you would have noticed?
We would have noticed.
Okay.
Yeah.
And is the amount of blood consistent with giving birth or a miscarriage or some sort of traumatic event?
I'm sorry, you repeat that?
Okay, the amount of blood in the bathroom, on the floor, on the walls, and is that consistent with the amount of blood that is lost when you give birth or have a miscarriage or?
To me, I mean, it looked like she had given birth in there and was trying to clean it up. Like, it wasn't that much blood on the floor, but you could tell she was cleaning it up because it was like smeared and somewhat cleaned up a little bit.
Okay.
Once you see that photo that Erica has, you'll see how we're trying to explain it.
Right.
It's just hard.
Okay.
Yeah, it's just hard for us because Leela had cleaned, because when I talked to her that night, she said she cleaned the blood first, then went to...
Yeah, and I usually, when there's like one or two things in the wastebasket, I usually pick it up and take it out, but I didn't that night. And then, like, I've been kicking myself on this because I feel like, if I would have just taken it out, I would have seen it.
Well, no one prepares for that type of thing. You know what I mean? Most people don't act like that. So don't blame yourself for it.
Yeah.
Because it's not a natural thing to do.
I mean, it's just hard because I'm a mother, I'm a grandmother, and I've dealt with death before, but never like this.
Right.
You know, like, it was horrible.
Don't beat yourself up about it, though, because it's something most people don't plan, or most people can't think of it. To them, it's like unfathomable. So don't beat yourself up about it, because it's something you couldn't have prepared for.
Yeah.
Because like you said before, you were expecting a miscarriage.
Yeah, I was just expecting her to have a miscarriage and call it a day. I mean, we've dealt with patients before that have had miscarriages.
Yeah.
So once the baby was taken into the trauma room,
Yeah, he went into trauma too.
okay, did you have what happened, what did you do at that point?
I just remember I stayed in there because she went to go get Dr. Vasquez, and then I noticed that the umbilical cord looked like an animal had tore it apart. Like, you know, have you ever eaten string cheese? Like, you know, when you twist it, that's how the bottom of the umbilical cord looked, and I just remember it caught my eye, and I was like, God, I was like, this chick really ripped this thing apart, because those things are hard to cut.
Right.
Did you find the other part of the umbilical cord?
No, we're thinking, I'm not sure if she had delivered the placenta, because I wasn't in there when they did the final examination. But either she delivered it in Loveless or she flushed it.
You always didn't find it at all.
We didn't find it at all. I even looked in the little cabinet that we have in our bathroom, because it has like a bottom cabinet. So I opened that up just as, you know, I didn't want no more surprises.
And how big would that be? How big would the placenta be? Do you have any idea?
No, I would say maybe me personally giving birth myself to a full-term baby, it would have to have been about the same size as the baby. Because I've seen placentas where we've delivered a few times here, full-term babies, and their placentas are pretty good size, or like that. Like, they fit inside of one of our basins.
Right. And is it thick?
It's
Or
like
is
a,
Or is it like,
it's kind of thinnish.
kind of like a sirloin steak?
Yeah.
Thin?
Like a-
you know,
Looks like roast beef to me.
okay.
Oh, that's not a good
Um,
picture in my head.
I'm just trying to describe
So-
it. But we didn't see it.
Okay.
And that, honestly, I thought that's what was in the wastebasket, was her placenta.
Mm-hmm.
I did not expect to see this full-term baby wrapped up in a trash bag.
So, after, like with HT and the doc at the room, did you do anything else with the baby or the patient after that?
After that, I was told to get a hold of the on-call OB in Loveless, because she needed to speak to her, because she had to transfer that patient out because she was bleeding.
Okay. And so you're the one that talked to the OB? Or,
I was the one that got a hold of the Loveless hospitalist, and I believe her name was Stephanie. And I had set up to where we got this patient transferred to Loveless, so that way they can go in and clean her out and stuff to make sure she wasn't hemorrhaging or anything like that.
okay, after that, any other involvement?
The only time I saw the patient was when I went in to have her sign her paperwork, the teleforms that she has to sign, because flight crew was on their way to transport her. That was the only time I had any.
Did she say anything?
She just cried.
She was just crying?
Because there was 2 police officers in the room with her at the time.
Okay. How many times did you hear the toilet flush, do you think?
More than 10 times. Because that's when I was like, dude, something's going on in there.
Okay.
And so that's what, because over 10 times, and you're like, and how long, what span of time did the toilet flush?
It was like, once it flushed, she waited a few minutes, and then she'd flush it again.
And like, how long do you think that was? Like, if you had to give a guess, how long do you think it was the whole time?
Out of the whole time between the flushing?
No, like,
No,
all...
from the time she went into the bathroom to the time she came out.
Oh, maybe 15, 20 minutes?
And how long of that was she flushing?
About maybe maybe 10 minutes of her being in there.
It was just constant flushing. So 10 minutes of constant flushing of 15 minutes being in there.
Yeah. Yeah, because when she ran to the bathroom, I did see her pass me. Because I remember I told the girls, because she had her hand on her crotch and one on her butt, and she was running to the bathroom, and I was like, damn, I guess when you gotta go, you gotta go. And, because one of the lab tech, Erica, was sitting there and we were talking, and she was like, dang. She was like, really? And that's when we noticed she was in there for quite some time. So I don't know if maybe the baby was already coming out and she just ran to the bathroom as fast as she could, or what.
So, for any other patient there, do you think anyone else could have delivered that baby?
We would have known.
You would have known? Okay.
Was there any other pregnant people on the
That
ER
night?
that night?
No.
And you said the last patient to visit was a 11-year-old female that gave y'all a sample?
Yeah. And her mom went in there with her.
And you were the last one in the restroom prior to...
That I know of, yeah.
That you know of? Okay. Alright, and you didn't notice anything like that, right? Okay, just gotta make sure.
No, I didn't notice nothing like that in there when we go to get urine from the bathroom. And I mean, patients were in and out of that bathroom, so I'm thinking, like, even the males, if they would have seen something like that, they would have said, hey.
Especially a dude like, hey, what
This bathroom's disgusting, you know.
Right? Is there anything you think we should know that we haven't asked you?
No.
No? Okay, well,
I gave you guys everything I pretty much know. I mean, that's just something I'm never going to forget.
right. Well, and I appreciate you telling me about Erica, because we didn't, we took photos after everything was clean. I didn't even know there was photos, so that's news to me.
Yeah, and then I had forgotten your name, and then I was like, and I hadn't seen any of the other officers that were there that night, so I was like, oh shit, who the hell do I call? Like, and then I figured, well, they'll get a hold of us.
Yeah.
And then I thought, well, that's why I told Erica, do not erase those. 'Cause
Right.
that's evidence that they need.
It is.
Yes.
It would be really helpful.
Because once we noticed that, that's when I had housekeeping stop her cleaning. And I go, that's a crime scene.
Well, she was very thorough, because it was very clean whenever we went in there.
She had gotten it, but like the wastebasket and all that, I was like, just leave it, because I remember it still had a little bit of blood on it.
Yeah, it had like a slight smear on it. We took photos of it. So you've been a nurse how long?
I'm a CNA.
Oh, CNA for how long?
Maybe like 16 years.
Oh, so you've been in the ringer.
Yeah, I've done nursing home. This is actually my first time doing hospital.
Oh, I'm sorry.
Yeah, that's why I said like I was used to deaths, but nothing like this.
Well, just reason I'll ask. So you said it was fresh blood, right? Have you dealt with dry blood, like dead blood? So does this smell fresh to you or dead?
This smelled fresh. Like, I don't know how to explain it.
But just in your experience, it was
Yeah,
fresh blood. It hadn't been stagnant for a while? Okay. Just wanted to make sure.
Yeah.
Okay, well, you have our contact information. And I gave the HR... Cindy?
Yeah.
Cynthia. Sorry, there's a Cindy that works here too.
Yeah.
I have Cynthia my contact information. If you have any more info, you can let me know, okay?
Okay.
I appreciate you.
Thanks, Lori, for coming in.
Thank you. Yeah.
And thank you for what you do.
Thank you. Yes.
Yeah. Hopefully it gets easier, right?
Yeah. Yeah. Well, I mean, I've dealt with stab wounds, gunshot wounds, but never like this.
Yeah, I understand.
This one was like the most gory thing I've ever had to. It looked like a Stephen King film.
Well, talk to people and keep your hobbies up, okay?
I
That's
will.
all I
Thank
can
you.
All right, thank you.
Thank you, ma'am.
Thank you so much. If you have any questions, you guys have my number, right?
Yes, ma'am. I got it from you the day of.
Yeah.
Yes, ma'am.
So if I don't answer, just shoot me a text. Sometimes I don't. If I don't know the number, I don't answer.
Okay, that's understandable.
Sounds like my mother.
Thank you, ma'am.
Thank